Cool. Part 1. Have you noticed a little twinge that wasn't there before? Maybe your energy isn't quite what it used to be. Or you find yourself getting out of breath doing something that used to be easy. And perhaps, if you're being honest, your first thought was just, oh well, that's just part of getting older. And you didn't really give it another thought. It's easy to fall into that mindset, isn't it, to just accept these little changes as an inevitable part of the journey? But there's a quiet, almost invisible habit that many people over 70 develop. And according to doctors, it's one of the most important ones to stop doing right now. This habit of simply dismissing or ignoring those subtle signals your body is sending can have far more serious consequences than you might imagine. It feels harmless, like you're just rolling with the punches. But in reality, it can mean the difference between catching something early when it's easily treatable and facing a much bigger challenge down the road. In this video, we're going to talk openly about this habit, why doctors are so concerned about it, and what you can do instead. Stay with me until the very end, because what doctors say you should do instead might just surprise you and truly change how you approach your health from today onwards. Part 2. So, let's talk more about this habit of ignoring or downplaying those little changes. It's incredibly common, and there are many reasons why we do it, especially as we get older. Maybe you've had a friend or family member complain constantly about minor aches and pains, and you don't want to be like that. Maybe you're fiercely independent and don't want to feel like you're suddenly fragile. Or maybe, and this is very often the case, you simply believe that reaching your 70s means that a certain amount of decline is just par for the course, and there's no point in bothering anyone about it. You might think, well, what do I expect at my age, of course? I'm tired. Or that little ache in my knee, it's just arthritis kicking in. Or my memory isn't as sharp. But whose is at 75? The thing is, while some changes are normal parts of aging, many of these subtle signals can actually be early warning signs of conditions that are much easier to manage or even treat effectively if caught early. This is where the habit of ignoring becomes dangerous. Doctors aren't worried about you noticing changes. They're worried about you noticing changes and then doing nothing about them because you've automatically attributed them to just getting old. Think about it like your car. If you heard a funny new noise, you probably wouldn't just turn up the radio and hope it goes away, right? You'd likely get it checked out because you know that a small noise now could prevent a major breakdown later. Your body is infinitely more complex and valuable than any car, but we often don't give its warning signals the same attention. Let's consider some common examples of these kinds of subtle changes that people often ignore. Persistent fatigue that isn't explained by lack of sleep or unusual activity. It's easy to say, oh, I'm just getting old and tired, but it could be a sign of anything from nutritional deficiencies to thyroid issues, or even more serious underlying conditions. A new, nagging pain that doesn't go away after a few days or weeks, perhaps in your back, abdomen, or elsewhere. It's tempting to dismiss it as a strain or just another sign of age. But persistent pain is your body's way of telling you something isn't right. Changes in digestion, like new constipation, diarrhea, or bloating, might be waved away as just eating something funny. But if they persist, they could indicate various gastrointestinal issues that benefit from early diagnosis. Even minor changes in vision or hearing, which we often write off as inevitable, could sometimes be related to treatable conditions or indicate other health problems. Unexplained weight loss or gain without trying is another big one that's easy to overlook or attribute to simple lifestyle changes. But it warrants attention. A new or changing mole on your skin, a persistent cough, a feeling of breathlessness doing things you used to do easily, changes in how often you need to use the bathroom. Noise, the precoyens, dant, anwerstitus capuitantakios. Gwenda catus tu skutapu tablets. The corridors are gostankojuers. He kakabine. Watanjuan namt, nan how to tigos kalkeki. The reason doctors emphasize this is because they see, time and time again, patients who waited. They waited until the fatigue became debilitating. The pain became unbearable, or the other symptoms became impossible to ignore. By that point, a condition that might have been simple to manage with lifestyle changes or medication is now much more advanced, requiring more complex, invasive, or difficult treatments. This is the painful reality behind the seemingly harmless habit of dismissing small changes. It's not about becoming hypochondriacal or worrying about every little twinge, but about developing a different habit, the habit of paying attention and communicating. The doctors I've spoken to and read about agree the biggest hurdle they face in treating many age-related conditions effectively is often the delay caused by patients waiting too long to report symptoms. They want you to understand that while aging is a fact of life, suffering is not necessarily an inevitable consequence of it, and many health issues can be significantly mitigated or treated successfully if addressed early. The focus isn't on finding something wrong. It's on ensuring that if something is changing, you know what it is and can take appropriate steps. Now that we've touched on the kinds of signs we often ignore and why doctors are concerned, let's dive deeper into the specific health consequences of this habit and why acting early makes such a profound difference. Part 3. Continuing our conversation about this common habit of dismissing small health changes, it's worth exploring in more detail exactly why this seemingly innocent behavior can have such significant repercussions, particularly for those over 70. Doctors are particularly attuned to this because they understand the progression of many age-related conditions. They know that conditions like heart disease, certain types of cancer, diabetes, kidney problems, and neurological issues often don't appear overnight with dramatic symptoms. Instead, they frequently begin with subtle, non-specific signs that are easy to attribute to something else or simply ignore. For instance, early heart problems might not start with crushing chest pain. They might manifest as unusual fatigue, shortness of breath during mild exertion, or swelling in the ankles. If you dismiss these as just getting old or being a bit out of shape, you miss a crucial window where lifestyle changes, medication, or minor procedures could prevent a heart attack or stroke. Similarly, certain cancers, like colorectal cancer, might initially present with only minor changes in bowel habits or a bit of unseen blood in the stool, symptoms that are easily ignored or attributed to diet. Catching these early drastically improves the chances of successful treatment and long-term survival. Even conditions that seem less immediately life-threatening can significantly impact your quality of life if ignored. Mild cognitive changes, if reported early, can be investigated to rule out reversible causes or identify conditions like Alzheimer's or other dementias at a stage where interventions can help manage symptoms and plan for the future. Joint pain that's getting worse might not just be arthritis. It could be a specific type that responds well to particular treatments. Preventing long-term disability. Persistent digestive issues could signal conditions like irritable bowel syndrome or inflammatory bowel disease, which are much more manageable with early diagnosis and treatment. Preventing malnutrition or severe discomfort. Doctors understand that there's a natural reluctance to seek medical attention for minor issues. No one wants to be told something is seriously wrong. There can be fear around tests, procedures, or receiving a difficult diagnosis. This fear is a powerful driver behind the habit of ignoring symptoms. It feels safer, in the short term, to live in uncertainty than to potentially face bad news. However, healthcare professionals consistently stress that while the initial conversation might be difficult, the long-term consequences of not having it are almost always worse. They see the advanced cases that require more aggressive treatments, lead to longer hospital stays, and result in a greater loss of independence and quality of life. Furthermore, ignoring symptoms isn't just about missing a diagnosis. It can also mean missing opportunities to make simple changes that could prevent a problem from worsening. For example, if you have slightly elevated blood pressure or blood sugar levels that are causing subtle symptoms like fatigue or increased thirst, addressing them early with diet, exercise, or basic medication can prevent the development of full-blown hypertension or diabetes, which have much wider-reaching effects on your body. Think of your doctor as your partner in navigating your health as you age. Their goal isn't to find problems where none exist, but to use their knowledge and tools to help you understand what's happening with your body and keep you as healthy and active as possible. They rely on you to be their eyes and ears regarding your daily experience. You are the expert on yuimusu. They are the experts on what different changes might mean. When you fall into the habit of ignoring things, you are withholding crucial information from the person best equipped to help you. This isn't about overreacting. It's about learning to distinguish between a temporary blip and a signal that warrants investigation. It's about developing the habit of proactive communication rather than reactive crisis management. It's about trusting that your body is trying to tell you something important, and that listening to it, in partnership with your doctor, is the smartest thing you can do for your future well-being. Knowing all this, the question then becomes, what's the practical alternative to this common habit of ignoring? How do you build the habit of paying attention and communicating effectively with your healthcare provider? That's what we'll turn our attention to next. Part 4. So, we've talked about the widespread habit among seniors over 70 of dismissing small health changes, why it's so common, and the significant risks doctors associate with it, namely, missing the early signs of conditions that are far more treatable when caught early. The good news is that the alternative to this habit isn't complicated or scary. In fact, it's about adopting a simple, proactive mindset and building a new, positive habit. The habit of paying attention to your body's signals and communicating them to your doctor. This doesn't mean becoming overly anxious or running to the doctor for every minor ache. It means developing a gentle awareness. Check in with yourself regularly. How are you feeling today compared to last week? Or last month? Are you experiencing anything new that persists for more than a few days? Is there a subtle change that just feels different? If you notice something, instead of immediately dismissing it as just age, make a mental note. If it continues or worsens, that's your signal to take the next step. And the next step isn't necessarily a battery of scary tests. It's simply having a conversation with your doctor or healthcare provider. Many seniors worry they'll be seen as complainers or that they're wasting the doctor's time by mentioning something small. Please, let go of that worry. Doctors want you to tell them about changes. They are trained to listen to your symptoms and determine if they are significant or not. You are not expected to diagnose yourself. You are simply expected to report what you observe. To make this new habit easier, especially if you have several things you'd like to mention or find it hard to remember everything during an appointment, consider keeping a simple health journal or notebook. Jot down any new symptoms or changes you notice, when they started, how often they occur, and if anything makes them better or worse. This isn't just helpful for your doctor. It helps you track what's going on and see if a pattern is developing. Bringing these notes to your appointment ensures you don't forget anything important in the moment. Also, when you have an appointment, make a list of your top concerns beforehand. Start with the most important one. Be clear and concise when describing your symptoms. Say things like, for the last 2 weeks, I've been feeling unusually tired, even when I get enough sleep. Or, I've noticed my right knee aches consistently after I walk the dog, which is new. Or, my digestion seems different lately. I've been more constipated. Remember, you are the expert on your daily experience. Your doctor is the expert on interpreting what those experiences might mean from a medical perspective. Working together is the most powerful way to maintain your health. By developing the habit of paying attention and communicating, you are giving your doctor the best possible chance to help you. You are enabling early detection, which often leads to simpler, less invasive treatments and much better outcomes. You are taking control of your health journey instead of passively letting things happen. This shift in habit from dismissing to acknowledging and communicating is one of the most impactful things you can do for your health and well-being after 70. It's about empowering yourself with information and partnering with your healthcare team. It's about recognizing that, while aging brings changes, it doesn't have to mean a loss of vitality or quality of life if you are proactive. So, let's make a commitment to ourselves, to listen to our bodies, gently and without fear, to write down what we notice, and to communicate openly with our doctors. This simple change in habit can truly make a world of difference, allowing you to live more fully, independently, and happily for years to come. We hope this conversation has been helpful and encouraging. Please share your own thoughts or experiences in the comments below. Have you noticed this habit in yourself or others? What helps you stay on top of your health? Your insights can help others in our community. If you found this video valuable, please give it a thumbs up. It helps us reach more people. And don't forget to subscribe to the channel for more helpful content on living your best life at every age. Thank you for watching. Live your best life at every age.